Ladies and gentlemen, friends and neighbors, it's Scott Hammond with the 100% Humboldt podcast with my new best friend, Michael Keleman. Hi, Michael.
Hey, Scott. How are you?
How's it going?
Fantastic. Beautiful day.
Beautiful day. You know, it is not that beautiful, but it's warm and muggy.
Actually, sir, from where I come from, it's beautiful. There's no wildfires. I'm not sweating. I'm doing quite well.
That's right. Yeah. No, I heard Medford's kind of smoky up in Oregon. Where'd you come from?
It's a loaded question. So,
First of all, who are you?
Oh,
what are you doing on this podcast?
I don't know, man. You just grabbed me off the street.
Drive right in this way.
So, as you said, I'm Michael Keleman. I'm the chief executive for Providence Health, serving Humboldt, which is St. Joseph and Redwood Memorial.
Nice.
We also have a medical group, about 200 or so physicians, and outpatient imaging center, et cetera. My home's the Bay Area. I grew up in the Bay. That's where all my memories are.
Nice.
I've lived all around the Bay, and it will always be my home.
Cool.
But I have lived in Sacramento, Los Angeles, San Diego, San Luis Obispo. I've really traversed the coast of California.
Did you call it San Luis Obispo?
Yeah, slow.
It's slow.
Yeah.
I love the Bay Area. I got 2 new hips from Stanford 13 years ago.
Oh, yeah.
I discovered now I can see why people love the Bay. It was warm summer days up on the hill, and then one day I woke up with 2 new hips.
I can't speak to the hips, but actually part of what I like about Humboldt is it kind of reminds me of the Bay.
Yeah.
It doesn't have the population, but if you go back to when I was a kid and my parents used to take me to Muir Woods or Bodega,
Nice.
it was accessible. Now, you can't get there. They're going to charge you $100 to park. And here, I feel like I can do things that I used to do in the Bay Area.
All day long, yeah. My wife's a big hiker, so she's taking me to all these places. I'm going, wow, there's a lot to enjoy here. There's a lot to do.
Agreed.
Yeah.
What brought you here?
What brought me here? Quick story. We were stoner, roving, free-range, feral hippie children roaming the streets of National City, which is a suburb of San Diego, just south, and blue collar, very poor. And we wound up in a career center at Sweetwater High School, one of the 3 oldest schools in San Diego County, besides 2 others. And there was a very beautiful lady named Charmaine who was running the night shift, and we looked at universities with her because we thought we were really interested. I think we're kind of interested in her, but we got to see this place on microfiche called Humboldt State University. And my friend Philip and I go, yeah, dude, we're going to become rangers and drive around and we'll smoke weed and it'll be cool. And little did we know that it takes a lot of, the fundamentals of calculus, chemistry, physics. And I made it. He didn't. I did get through with a degree in liberal arts.
All right.
No science background. I don't know how I got through high school without algebra 2. So I just kind of negotiated there, but yeah, that's what got me here, and married Joni, and met Jesus, met Joni, got sober for 30 plus years, and got a degree in recreation.
That's cool.
Recess, if you will.
Yeah, that's cool.
So we're having fun today.
You've had a journey. Wow.
I got a whole journey. Yeah. I want to talk about your journey. So you went to high school in the Bay Area?
Yeah, I went to a school called Bonavista Vista High down in a town called Danville.
Sure.
East Bay.
Bonavista Vista, is that Catholic school?
Nope.
No,
far from.
Public?
Yeah.
Yeah, we have a bunch of homeschoolers in our house.
We tried homeschooling. We still consider it.
Yeah.
Yeah.
Anytime I meet a homeschooler, I go, hey, weirdo. And they go, yeah, that's me.
Yeah, although I think it's becoming more normal.
Totally, yeah.
I think more and more people are getting tired of, not the curriculum so much, but just the drama with this generation of kids. And I'll be honest, my wife and I, at least 2 to 3 times a month, we're like, do we homeschool again? Do we do it again?
How many kids do you guys have?
2 boys.
Nice. How old are they?
25 and 10.
You have a 25-year-old son.
I do. Yeah.
Gosh, I got you for like 35.
Thank you.
Crazy.
Oh, we should end this right there. That's a perfect moment.
Hey, Michael's really young. And I'm young on the inside. No, that's amazing. So, yeah, my son went to UC Davis and got a doctorate.
That's my undergrad.
Yeah, he went to poli-sci. He was majored at poli-science.
It's an amazing campus.
Oh, he's a great guy and he's a great professor. All the professors said, Jesse, tell us how to homeschool. We want to homeschool. So professors were reverting to a homeschool model, knowing that there was some benefit there. So he became a little expertised for a minute and a little bit of celeb. But anyway, so Bay Area, where'd you go to college?
I did UC Davis for my undergrad, and I went to USC for graduate down in LA.
What'd you study at Davis?
Kinesiology. I was pretty adamant I wanted to go into medicine.
Wow.
My father was an administrator at UCSF, and at that time, it was early 2000s. And so that's when like this concept of corporate medicine, electronic healthcare, all this stuff was happening. And so every physician I met was like, please don't do it. It's the worst job. And
wow.
Like, oh my gosh. And so, you know, in my 20s, I was like, you know what I'm going to do? I'm going to learn business. And I'm going to fix healthcare.
Nice.
And so I did that. And here we are.
Nice.
Fixing healthcare.
So we've gone from an analog society to digital. And it's like not without some
pros and cons.
Interesting pros and cons. Yeah.
Yeah.
So what'd you study at USC?
I got a master's in health administration.
Sweet.
Yeah.
Great school.
I loved it. I wouldn't recommend it for undergrad, but for graduate, I think for graduate, what I really loved about it is undergrad's fun. Undergrad is a college experience. I'm just gonna be frank. Sure. And those private universities, they don't have the same, like you go to Davis and it's a college town, right?
It's fun.
It's amazing.
Yeah.
Massive campus. Graduate, though, I feel it's really about now you've decided consciously what a pathway is. And what I like about USC is there's a network, there's connections. And, you know, and even when you graduate, you can do a thesis or a fellowship. And the fellowship gave me an opportunity to interview, and I was able to be mentored by Chris Van Gorder, who's the CEO of Scripps Health. So for the first 3 years, right out of school, I'm working with one of the most renowned leaders in healthcare.
Wow.
And so I owe a lot to my alma mater in that regard.
Where are they based? Are they LA,
San Diego?
They're San Diego?
Yeah.
La Jolla?
They have a campus in La Jolla. They have Green and La Jolla, which is their main hospital.
When you're from San Diego, you call it La Jolla.
La Jolla.
It's kind of funny. It'd be there. Slow and La Jolla. No, Davis is a great campus. A lot of fun there.
I loved it there.
Yeah, really. Jesse had a great experience there.
Yeah,
I met with professors.
I'd like to live there still if I could.
Yeah, and SC's a great, gosh, you know. Are you still a Trojan fan?
Yeah, they brainwash you pretty good. I laughed a little bit because the first semester you go in, and I still remember calling my dad and being like, oh my God, they're trying to brainwash me.
Oh yeah,
there's this Trojan thing. Yeah. And then like, you know, by the second semester, I'm throwing V's and success. They've done it.
I have Trojan jammies. We did your Trojan colors today. I don't know where the yellow is, the gold.
I have USC Trojan baby gear for my kids when they were babies. So yeah, it works. They're very effective.
Good school. So the guy that actually did my hips, Dr. Bellino at Stanford, studied under your guy at SC, Dr. Cho. He perfected the anterior approach where they cut the front.
I did not know that.
So they used to cut you all the way around the hip, which is crazy healing time. And he perfected this, and this guy was his mentor. So
that's amazing.
He was the mentee and the mentor. And yeah, good job. He did 2 hips in one day, bilateral hip surgery. Yeah. Hey, this is about you though, not me. So what'd you do out of college?
Oh man, so I got a fellowship, San Diego's with Scripps Health for about 2, almost 3 years.
Was that in La Jolla?
Yeah, it was.
That's across the highway, though. It's kind of east of the 5. Or
there's 5 hospitals down there,
right?
And then a massive medical group. And what's nice about the fellowship is it gives you exposure to not just the hospitals, which serve varying communities, but medical groups, just things that I didn't really even understand in graduate school. And met my wife down there.
Nice.
And I surfed a lot.
Did you ever go to Black's Beach?
Yes, I went to Black's Beach.
Have you ever
No, I didn't go nude.
Took my question, Nick. Dang it. So for those of you that don't know, Michael clearly knows, Black's Beach is probably one of the most beautiful beaches in SoCal. There's no doubt because it's isolated. It's below cliffs. And
Coronado's pretty great though too.
Coronado's beautiful. Black's is iconic in the sense that it's got killer waves and there's not as many people because you have to hike to get there. And one of my favorite memories is one morning waking up on a surfboard with no clothes on. And
it was your stoner day still.
Yeah, no, it was a couple weeks ago. Jody and I were on vacation. I just had to go for it. And I was probably 17, and it was 75 or 80 degrees outside, and the water was 70, which is like, you're surfing in hot tub water.
Yeah.
Not quite, and it was just like one of those, and the spray, there was an offshore, and the waves were like little nice 5-6 footers.
SoCal surfing is amazing.
It's such a beautiful place.
It's very predictable.
Yeah.
I will say, though, learning to surf up here, it's very humbling.
Oh, yeah.
And I feel very confident to surf anywhere I want at this point. This is...
You can go to Alaska from here.
Yeah.
Yeah, so you surf here. So like
I do, yeah.
on the what's it called? Not the bay, it's the mouth.
The jetty?
The jetty.
No, sir. I have children. I'm a responsible
How about
adult.
inside the jetty? The north side, north
I went to
jetty?
Samoa. One of the physicians, Dr. Brandon Byerly, he's a general surgeon. He took me out, and I didn't go back. I then discovered Trinidad and Moonstone. Camel I've just discovered, and I love it.
Camel's cool.
It's amazing. Yeah.
Camel's our date spot. So during COVID, Joni and I would take the van, because we're 5 minutes away, and go to Camel. We got about 5 different places that we park.
Yeah.
And in fact, we missed it. We missed it for 2 months, went Sunday. Bottle of wine, open that thing, look at the sunset, and don't tell any of your friends, because it's just a magic.
Yeah.
Here I am like peeling clothes off because it got so hot from the water.
You trying to get naked on that surfboard again?
I did not. I didn't, honey. I wasn't. I took my shirt off. That doesn't count. So, what a great place. And, back to the coolness of Humboldt, and going, why would I leave God's country?
Moonstone has become one of my favorite places right now, for a few reasons. I can surf there. My 10-year-old can learn to surf there. And then what's amazing about it is when you get out of the water, it's such a large beach, and there's such a diverse sense of what people are doing, right? There's gentlemen rock climbing. There's people like playing ukes in a little circle, hanging out and singing.
The river.
It was just, I had that moment where you're looking around going, wow, this is great.
Oh, yeah. Yeah. I'm going to show on the map here in a minute where Moonstone is, for those of you that don't know. It's right over here on my map. See it right north of Arcata, south of Trinidad.
Oh.
That we never.
I thought in Humboldt we don't give away those secrets.
Yeah, nailed it. Yes. Secret spot, Moonstone Beach. You will never find it. I have a friend that works up in Brookings, and he sells advertising. And Justin's a great guy, really killer surfer. You might have met him. He's bald. He looks like Kelly Slater. Anyway, hi, Justin.
Does he make boards in the area?
I don't know that. He's a dancer. He teaches dancing. Okay. Anyway, he's got secret spots, and he shoots them, and you can't really tell where it is. But he's like Southern Oregon is dialed in. But it has to break right, of course, because it's surfing.
Well, I've heard Crescent City. I'm just not willing to drive 2 hours to surf, to be honest. I used to do that in the Bay. I'm over it.
Yeah. Not when you could go to Moonstone in 10, 15,
a little bit
20
closer.
minutes.
Yeah.
So what'd you do after you got out of SC? Oh, you Scripps? Okay.
Yeah, so I did Scripps, and then I hopped. I wanted to learn as much as I could. And so I took everything I learned from Scripps. I took what I liked and that I thought I could apply naturally to my own style, and I left the rest behind. And since then, I worked for Stanford. I've worked for John Muir Health. I've worked for Tenet Health, and I've worked for Kaiser Permanente and Sutter Health.
Wow. So
I just tried to expose myself to everything I possibly could.
That's a lot of systems.
Yeah.
Probably all of them have good and bad to glean from.
I have this philosophy, and I actually convey this with our caregivers here. My goal is to grow everyone to the point that basically they can go anywhere they want. And if they leave me, that's okay, because it's a small world in healthcare. But to your point, everyone has a different style. And so, so you take what is great, and every single health system and organization has something great about it. And then there's things where you're like, gosh, why do we do this way? And I think where you finally land is the place that you get more comfortable with, okay, this sucks, but I can tolerate this because these things are so good.
Right.
So
I was gonna laughingly say, sounds like marriage.
Yeah.
Love you, honey.
Yeah. I saw a meme today about marriage. It said, marriage
she would say that about us.
Well, so the meme goes, marriage is solving problems together, but they're problems that you wouldn't exist if you were single.
Good one.
It's like,
I like that.
I love my wife.
Yeah, me too. We both married up, right?
Yes.
Yes, we did. We're doing amazing. We have an amazing one. Hey, if you're just joining us, my new best friend, Michael Keleman, CEO of, is it Providence St. Joseph, or is it just Providence, period?
Just Providence Health.
Providence Health, but not in Medford, because that's Providence too, right?
Yes, very robust in Oregon.
Hey, let me show you how.
Okay.
Right there. See that?
Oh.
So on my 3-day sabbatical up in Jacksonville, I disobeyed the mountain bike advice and said, "Hey, don't go the left trail." Went on the left trail. And this is a very sexy accident. I just fell. And I'm laying there and I go, I think I'm okay.
Yeah.
And I get up and I get the bike and my backpack and I look at my arm and it's just covered in blood. So what I did is I split the fold in the finger.
Okay.
And so I went to Providence Urgent Care.
Mm-hmm.
Stewart Canal. Anyway, and he got me 4 stitches. Within an hour, boom. Back on that bike. No,
no. Took that left again. And
my daughter picked me up and bought me coffee and an In-N-Out burger. And she goes, "Are you okay?" And yeah, I'll be okay.
Oh my gosh. Okay. I'm glad you're well. I'm glad it worked out for you.
Yeah, no, got my stitches out today. And so, no, I've been very happy with Dr. Dan Hain.
Yeah.
Shout out, Fortuna, Redwood Memorial.
Yeah, he's also single and looking for a partner.
Great guy, man.
So you want to get the word out about that?
I'm not even looking, but he's a cool guy.
He is a good guy.
He's a solid dude. I asked him, I go, "You married?" He goes, "Nah, not yet." Because I'm super busy here.
He bought his house in Ferndale, and he's at that stage in his life where he wants to have a family.
He's a Ferndale guy.
I feel weird speaking for him right now. He's going to listen to this, be like, "What is this guy doing sharing all my secrets?
What's this guy even? What is he talking about me?
What the heck?
My boss. What's he doing?
Never talking to him again."
Yeah, right. So how about this? Let's talk about kind of a time arc.
Sure.
Of St. Joseph, the sisters. Maybe when it just.
Sure.
I mean, you could probably bring that in within 30 seconds, but that time arc getting us forward. Opportunities, strengths, weaknesses, and maybe get us to current. And then we'll talk about the future a little bit.
So kind of the origin story of how we got here?
Yeah.
Sure. So mind you, I've only been with Providence Health since it's been maybe a year and 8 months.
Wow.
Okay, so I'm new, but I'll tell you what I know.
Welcome to Humboldt.
Hey, thank you.
Yeah.
So essentially Sisters of St. Joseph, there's 12 sisters led by Mother Bernard. They came from a town called Le Puy. It's a place in France where if you want to talk about faith, their church sits on a volcanic cone in that town. It's pretty amazing.
A lot of faith.
But what's amazing about their story is, so Father Madai was one of the priests, and he said, "Hey, go out into communities, find like-minded individuals who share in your values, find a problem, and solve it."
Wow.
And so that was really kind of different because it used to be come into the walls of a church, and this was no, we're going out. We're going out to the communities we serve. And so they landed in Eureka. I think it was 1912.
Steamer from San Francisco or wherever.
Yeah. They're supposed to go to Sacramento. So it's kind of an incidental landing. But they were going to open schools, education. The pandemic hit. They partnered with the Mayo Clinic, taught themselves everything. And what I like to share with caregivers is, however hard you think your day is, at one point in time, there were 12 sisters who ran a 24-bed hospital, and they ran everything. So it's pretty amazing that you think about when we say we've been here for 100 years or more to serve this community, we've literally been here for 100 years in this community.
That long.
This is where it started.
So was there no hospital in Eureka prior to them?
No, my understanding there was a hospital, but I believe they closed. What's also really special is the Sisters of St. Joseph. So St. Joseph Health in Providence kind of came together in 2016.
Mm-hmm.
The first hospital for the Sisters of St. Joseph was here in Eureka. This is literally where it started.
This is ground zero for those guys.
It's really cool. And there's something, it's very deep in the DNA of this organization. Even within Providence, when I go up to Renton, you'll meet the sisters. And when you say you're from Eureka, it's...
You got cred. Street cred.
Yeah, it's just woven into the DNA of the organization.
Where are you from? I'm from Eureka and Humboldt.
Right.
Whoa.
They know it. Yeah.
Usually we're known for other things, but good job. We were at the Hollywood Bowl once, and I had a Humboldt shirt on. A guy goes, "You're from Humboldt?" I go, "You ever heard of Humboldt?" He goes, "Oh, yeah." I go, "Hey, could we sit in the box seats up there? Because it looks like they're empty." He goes, "Sure, dude."
You want to box it up?
He's looking for a tip, I think. But so when you go up there, they know Eureka.
Mm-hmm. Same down in Los Angeles when you go to the Sisters of Orange, which is... They relocated after about 10 or 11 years of being here.
In Irvine, right?
Yeah. And they went there because the population was bigger. But it's still in the DNA.
Yeah, the corporate building was right next to where we trained at State Farm 100 years ago as agents.
Oh, wow.
I'm going, Sisters of Orange, what?
Small world, right?
Really weird. It was really weird. I'm going, this is super small. So,
we're intertwined in your life too. Look at that. That's
wild. No, well, more than you know.
Yeah.
Yeah, no, we've had babies and surgeries and ER visits, and
it's kind of cool, right?
All manner of fun. Yeah. Well, with 9 kids, I'm going to show up at your hospital at some point.
I think it's amazing though when you think about take out the hospital and just look at how healthcare, how it's. You have to almost separate the organization and think about like that. There is something that is beyond the tangible building, right? Like those experiences you have. It's cool.
Yeah, I would say that's more true for us with Mad River Hospital. Without all due respect, the Doug Shaw and his crew and the birth center, and we've had 2 or 3 babies there. And Connie Bash did a C-section. Well, Dr. Putler did a C-section on my wife, and a VBAC later. And so all this, all that narrative that's not just transactional, it's family.
Mad River's amazing.
They're cool.
I don't know if there is, and I honestly don't know the answer to this, and I'm curious. They are a freestanding, wholly owned hospital. Like Doug Shaw owns and runs this hospital.
It's pretty rare, right?
Yeah. And it's awesome.
Yeah. Nice guy.
Oh, he's great. Yeah.
You hear that, Doug? Doug's promised to come on. He swore. Promised me. No.
Oh, no.
He'll be on the show.
He's a good guy.
I think Doug's got a lot. He's a good man. I've known Doug a long, long time. So the origin story, and so the sisters got things going.
Yeah.
And then grew this thing.
Yeah.
And it got acquired. Carry on.
I don't know if it's an acquisition. My understanding is like our values, for example, right? It's dignity, justice. They apparently St. Joseph and Providence were very, very similar. And the 2 ministries came together and realized how similar they were. So I don't want to say it was an acquisition, because you'll notice actually I refer to it as Providence Health because that's what I've been accustomed to as the main employer, but I still see St. Joseph. And even on the corporate level, so Eric Wexler, he's the new president for Providence right now, but he has a board above him called the sponsors, and it's a 50-50 split of Providence sisters and St. Joseph sisters. Wow. And they're the ones who kind of make sure that we're still staying balanced and following the mission and our legacy and our heritage.
Remember doing a speaking training for some friends in that. Where's that stayover place across the parking lot where you guys have?
Oh, the Evergreen Lodge. Yeah.
Yeah, I was over there and we were doing a training, and I was doing the training, and the sister came in. Gosh, I don't know her name. She's maybe still not there. I don't know. But there was like this reverence for her sister because she was super cool. She'd been there for 200 years. And
probably not that bad.
She looked great. She looked great.
They're not internal.
Yes, they are. But she looked fabulous, and she was really sweetheart, humble. Yeah. And I just remember the vibe. I don't even know what she said, but it was something sweet, something Jesus, and I loved it. Loved her, and you could tell that part of this outreach of whatever I was doing was helping Hispanic nursing moms and young families.
Paso.
Could have been underprivileged in some way, and they were absolutely all over that, and it was cool. So take us into broken healthcare. And this
is done. No,
I gotta go. So for the origin story to kind of maybe where we're at, and we've been called a medical desert for a couple of reasons. How would you characterize all that? And then I want to certainly talk about vision in the future and what you're doing.
Oh, there's so much to unravel, Scott. Okay, let me start with not a medical desert, and I think. For someone, I just shared with you all the organizations I've been in and everywhere I've lived. Okay.
Sure.
Healthcare is probably in one of the most challenging times it has been since probably the 60s when Medicare was kind of going out. And I say that in terms of dynamic change. Some people will tell you that we're actually in a healthcare revolution, which I really like that phrase because it is shifting. And what's really unique about Humboldt is I think we have these claims of how we're in this desert, as you refer to it. But in reality, I can't tell you the number of times I call on friends and colleagues in San Francisco, back in San Diego, San Luis Obispo, and they're struggling. They are struggling to maintain coverage and access. And what's unique about us is, I'll tell you the benefit and kind of our opportunities. So we actually offer amazing care. We have full comprehensive oncology. We have radiation oncology. I know Dr. Liu was on here at one point.
Dr.
Right?
Liu's the bomb. Yeah.
Yeah.
What a great guy.
We have neurosurgery, trauma,
Johnny
NICU. We do things here that if you think about rural healthcare, we live in a rural community, but we have metropolitan healthcare here. Okay.
Mm-hmm.
The challenge though is, so for example, we have a physician and his name's Dr. True. Dr. True is a vascular surgeon who also can do robotic lobectomy, thoracic surgery. Find me one rural community that does robotic thoracic surgery. It's not even that prevalent yet in metro areas. We do that here. Here's the catch. There's one guy.
Right. Better than none.
So, and that's where the focus is trying to get a sense of what is the core need within these communities.
Mm-hmm.
How do we, Providence, rise to that occasion with the resources we have?
Right.
The other benefit I think we have in Humboldt that I have never seen anywhere else I've ever lived is the collaboration. And you mentioned Mad River, for example.
Mm-hmm.
Not only with Mad River, Sutter Coast, Partnership Health Plan, UIHS, Open Door, we all talk.
Mm-hmm.
We actually come together and we talk.
Because it's Humboldt and people do that.
We collaborate on, here's the problems in front of us. How do we work together to solve these things?
That's very cool.
I've never seen that anywhere else.
Is that a panel? Is that an organization? Is that just informal?
There's a few. Some of it's informal. The more formal process that actually the chamber is now helping us lead is we're starting a program called Home in Humboldt. And Home in Humboldt is an initiative to help with physician recruitment. Mm-hmm. And it's all large employers. So Cal Poly's at the table, Coast Guard's at the table,
wow.
College of the Redwoods is at the table. And we're collaborating to go, how do we help bring in providers? Because I don't care what your business is. You could say, oh, I can't find talent for my school or my education system. Okay, great. Part of that reason is because if they come here and they can't get with a doctor or they don't feel confident in the healthcare provided to them, they're not coming here.
It's not an option.
Correct.
Yeah.
So I've been really, I guess, thankful, blessed, I'm not sure what the right word is, a little humbled by the fact that to see these people come to the table and we're working together.
Mm-hmm. And there's Destination Humboldt.
Yeah, Destination
Obviously.
Humboldt. Yeah.
Yeah.
That's more of a community philanthropic campaign that helps us do loan forgiveness, invest in equipment. So for example, that robot I was talking about, that's a Da Vinci surgical XI system, right? It's a state-of-the-art surgical robot. We have it here.
Wow.
Philanthropy.
Yeah.
You're down with Dr. Hain. We're expanding Redwood's family practice so we can house another 3 primary care physicians before the end of this winter, as well as a family therapist.
Wow.
That's philanthropy.
3 more.
Yeah, we'll have 3 more primary care and a family therapist down there before the end of the year.
That's pretty good. That's really good.
Yeah.
Jody and I would not have primary care if it wasn't for that.
Yeah.
Yeah. And Destination Humboldt, big doings, man. Good thing. Bringing more. There's some more docs coming then. Obviously, there's probably people in the queue at all times.
We've brought on about 21 or 22 doctors through Destination Humboldt. Last year, we brought on 44 physicians. This year to date, we've brought on 25.
That's great.
Yeah.
And we still need more because there's probably...
Oh, yeah.
Maybe the medical desert has to do with medical gaps. There's probably stuff that we're not great at.
It has to do with subspecialization.
Right.
So, for example...
so there's layers to this argument. I mean,
it's complex, man.
complexity of the problem and the opportunity.
Well, think of it like this. So I'll give you an example, okay? Gastroenterology, okay? You used to have... I'll also give you 2 examples. Gastroenterology, there's this new generation of physicians who are gastroenterologists, and they want to work in the ambulatory. They want to do outpatient. They want to work on the medical side of it. They don't want to take call at a hospital.
Right.
But there are emergencies that happen. So now I have to hire 2 different people to do what one person used to do, right? The other thing with subspecialization is vascular is a good example. You get an old school general surgeon and they did it all. They did vascular surgery or general surgery. They did everything. Mm-hmm. Now there's like, well, oh no, I'm a vascular surgeon. That's a general surgeon. So now you're bifurcating specialties. And there's a lot of benefit to that, right? Because these people are becoming experts in their fields. But it's requiring more resources to do the same work that used to be done by less people.
By 1 or 2 individuals.
Yeah. So it's hard.
Did you know Dr. Adams before he left? He was a military guy.
Oh, cardiothoracic surgeon, Dr. Adams. General
Correct.
Adams. Yeah.
Correct.
Don't know him personally, but I know the name.
What a great guy.
Yeah.
Legend.
He just got honored, actually.
He's about to be honored. I think he's getting the This is the Purple Heart.
It's something big.
It's huge. Yeah, he's interesting guy. He was one of our Humboldt heroes. You asked how I wound up here with Nick, and we recognize vets once a month, and he was an early one, and just a fascinating guy in terms of the stories in Afghanistan and in Eureka-stan.
Yeah,
and just some of the stuff that he's dealt with, and just some insight into medicine. Speaking of cardiovascular,
yeah.
Well, cool. Let's do the quiz show. You ready?
I think so.
It's okay, Michael. You'll be fine. If you're just joining us, it's Michael Keleman about ready to win a candy bar if he plays his cards right.
Oh, man. I'm still new to the community, right?
Are you really?
Yeah.
How new? Wow, come on.
Last January only.
That's pretty new.
It's not even 2 years.
If you're in Ferndale, that'd be pretty new.
I'm in Fortuna.
Right? It's the friendly city.
It is.
It's just a matter of just going to hang out and get to know people. Have you ever had a Dick Taylor?
I have,
chocolate?
Yeah.
Are they good? I have no idea. I just have these.
I don't like the dark chocolates.
Oh, you're not a dark? Okay, perfect. This is milk chocolate.
I like the milk. Yeah.
Here's the deal. So
good coffee too.
If this is so somebody likened it to this. If this was a $10 candy bar.
Yeah.
I'm sorry, it's not candy.
Chocolate bar.
Premium chocolate
Don't
bar.
offend them like that.
Yeah, it's only cacao and sugar, dude. It's not got, this one has some cane sugar and some cocoa butter. I never really talk about it this much. So, if this was a bottle of scotch, it'd be $500.
Okay.
Because it's top of the line chocolate.
I agree.
So I needed some top of the line engagement here on this quiz.
Oh, man.
Are you ready?
I think so.
All right. Question number 1.
I get test anxiety.
You're fine.
I need some beta blockers.
Can only lose the candy bar. Question number 1. Are you ready?
I think so.
You have the entire day to do whatever the heck Michael wants to. No expense spared. 9 a.m. to 9 p.m. Day after tomorrow, Friday. What are you going to do in Humboldt?
I'm going to surf all day, man.
Really?
Yeah, that sounds amazing.
Where?
I would go up to Moonstone. I'd bring my family. My wife would probably let our dog run around. She'd go boogie boarding. My 10-year-old would be out there picking up on small waves, and that'd be amazing.
Just all day on the beach.
Now you're just making me kind of hate the fact that I can't do that. That's a messed up question. Like, wait a minute.
Unintended consequence.
I played the Powerball last weekend. It did not go well.
It did not go good. So an all-day beach trip. Okay.
Oh,
I mean, with this weather, it's kind of balmy. It would be beautiful.
It wouldn't bother me at all. I love it.
Yeah. Don't you guys get cold in the water?
No, I don't. You're paddling. You're moving around.
Yeah. Yeah. Especially, watching some of the waves at Moonstone.
It's beautiful.
When it's breaking right, it looks like it's really a fun
Last
bunch
couple
of waves.
weekends have been so great.
And there's a lot of breaks too, all the way down to, I'm thinking of Camel all the way down.
Mm-hmm. Yeah.
It looks like there's several and hundreds of people. Hey, question number 2.
All right.
What's your best day in your life? Maybe one of your best days.
Like actual day that's happened? Mm-hmm. Ooh, best day in my life. This is going to sound weird. I'm going to say the birth of my son, but here's the thing, my second boy. At the time of birth, I did not bond with my son right away.
It's okay.
And everyone's like, you got to love him. Like, I don't know who he is.
Yeah. Dude, I got 9 kids, and trust me, it's not abnormal.
All right. But the love I have for him now,
sure,
I'm so thankful, and I reflect on that day. At least once a week, I reflect on the day my son was born, and I still remember putting my finger in the palm of his hand, and he just grabbed it with a little baby kung fu grip, and it was awesome. Yeah.
Where was that at?
John Muir.
That's Bay Area, right?
Yeah.
Yeah. Know it. Okay. Good answer. Yeah. I don't think it's instant bonding all the time. It's bonding of another kind.
It's a labor of love.
Yeah. I mean, I start to bond after they talk, I think.
Yeah.
It takes me a minute.
It took me time. I thank you for saying that.
And
yes.
It's a dude or a dad. I don't know. Or just maybe
it's just us.
Closed off.
Maybe we're just cold souls. I love you now. I love you so much.
So much. Son. Daughters. Okay, good answer. Number 3. Worst day of your life, or one of them.
Oh, man. Worst day of my life. Jeez.
A worst day.
How about I answer it more as a generality? My hardest days are when there's something going on personally.
Mm-hmm.
Because when things are going on at work, and I mean every day there's stuff, man. It's a hard
It's the
job,
job, yeah.
but it feels manageable.
Mm-hmm.
And for some reason, when it's personal, like if something's going on with my wife, if
Mm-hmm.
something's going on with one of my boys,
Yeah.
it's so hard because you not only want to be there, you want to solve it. You want to solve it right now because you don't want them getting hurt,
Sure.
but you can't.
Because you're not, yeah.
You just can't for so many reasons. One, you can't constantly be there to save them. They need to grow and they need to have their crucible. But two, you physically, emotionally, whatever, you honestly just probably can't.
Right.
That's so hard. I've gone through that sometimes. My older boy, he had to move back in with grandpa recently. And it was hard watching him go through, growth and maturing,
It's a great admission. I think it's totally a truth that the school of consequences, which we'll go through.
It's hard to watch though, right? Like, it's good for your children.
So good.
And you just hope they lean on you when they need to, but it's so hard.
It hurts so good, man. Yeah. My son came home crushed last night after a really hard day with this assassination and of his guy. He loved that guy, and a breakup with a girlfriend and the job, and he's cutting now. He can bench 465, so he's a bodybuilder, and he's kind of a badass. But last night he said, I screamed in my car all the way to McKinleyville. I cried in my car.
Yeah.
And maybe one day Michael will see this and he'll know that it was a tender moment for Joni and I. And he came to the bar, not the bar, the bar at home.
Yeah.
At 11 at night, and Joni and I just sat with him, just hurt with him. And it was really cool. It was really a tender, good moment that had to happen.
Yeah.
And he goes, and he made several admissions about his own process in life that were really broken-hearted, good admissions of truth. And like, I don't have answers, and maybe I do need counseling, and maybe, life sucks, and there's division out there. And Dad, there are people that really suck out there, and they're terrible individuals. And I'm going, wow, I wish I could argue with you. I'm not, and so it was just that supportive sort of moment. And wow, can I answer a question? Question number 4.
Sure.
Good answer, by the way. What do you find crushing and soul sapping, and just what takes it from you when you are a little kind of akin to the worst day, but not necessarily?
I'm going to try to say this the right way. So this will be related to work. So there's about 2,000 caregivers that work between the two hospitals. Doesn't even include the medical group.
Wow.
Med staff's probably close to 400 to 500 physicians. Okay. These are members of this community. Mm-hmm. These are people who see thousands and thousands of people every single year.
Y'all are a big employer, right? I mean, perhaps number one, maybe the university is out there.
Maybe Cal Poly or us. Yeah, somewhere. We're large, for sure.
Sure.
But what's hard about it is 9.9 times out of 10, we do amazing things. Amazing things. And that's something I always tell the team. You do amazing things. There are moments where we fail. There are moments where someone slips through a crack and we don't know how that happened, right?
Sure.
And we get bashed.
Oh.
And I don't care personally, to be completely frank. I get kind of protective though. And the soul sucking part is when people try to bash and try to make their statements like they know. And I sit there and I go, these are your neighbors. These are people that live in this community that go to school with your kids.
You're going to see them at Safeway or the co-op.
And they care about you. And at the end of the day, they care about you.
Right.
But you're in this moment. But that moment hurts these caregivers. It hurts these physicians.
Personal level.
It does. Yeah. Because they're trying. Mm-hmm. That's the soul-sucking stuff. And it kind of goes back to the children thing, right? Which is, I want to help and I want to fix it. I can't. And so you just try to remind your team that you do amazing things.
Yeah.
Don't let anyone else fool you differently.
Turns out we're all pretty human.
Yeah, I think that's a key too. What you mentioned with your son, I appreciate. my wife and I have done a lot of counseling, and I, to this day, think it's like the hero of my life, and everyone should do it. I think it'll make you a better leader.
Sure.
And it's funny, as humans, not just roles, but as human beings, we all tend to think that it's like we're alone.
Right.
And like no one understands this, or, oh man, I don't want to do this. That's embarrassing. Even though like the guy right next to you is having the exact same thought, right?
Or worse.
And it's like, how do we break those shells to go, look, yeah, sometimes you got to toughen up. Sometimes you got to work through things, but you should never think you're alone in it.
Good word.
All right. So
preach it, man. That's good. That's good. And we're so American and independent, and sometimes we're dudes on top of it, which is our bane.
Yeah.
Sometimes as a gender, we just go solo. I'm Lone Ranger.
Yeah.
Want to see all my arrows? I got some spears in there too, bro. It's like, no, I don't. In fact, that's sad that you would take all those alone and not reach out and go, hey, I hurt like hell.
Yes.
Can someone help me? And now I'll just die with my cancer or my stroke or aneurysm or my bitterness or my bottle. And it's like, so for you, all you guys out there, you young and old fellas, it's funny I could say that now. I have like a gray beard and I could say things.
My son says it's sunscreen.
Yeah. Nice. Yeah. You see a little bit.
He doesn't accept my imminent death. It's like, no, Dad, it's sunscreen. I'm like, no, Dad's dying.
No, it's evidence of death.
Yeah.
Yeah, no, it's
slow and steady.
It's true. Just believe your dad. It's coming for you. Okay, last one.
All right.
What's fulfilling for you? What fills up your cup, your soul?
Two things. I'll give you a personal and a professional. Professional, myself and the rest of the executive team. This is the first time I've ever done anything like this. Once a month, we volunteer our time in the community. So we've worked with Betty Chin, we've worked at the food bank, we've gone to our resource centers.
Nice.
Those are the best days.
Oh, that's cool. Betty's cool.
I mean, when you go out there and you, it's not the refilling of the cup because you're like, I did good today. It's you meet people that you probably would have never have talked to.
Right.
And it goes back to that human thing. And you engage and get to know someone that is on a completely different side of life than you.
Sure.
And you bond. It's like such a good feeling.
Wow.
The personal is, I go back to my kid, man, seeing your kids thrive, seeing them laugh, smile. I know it's hormones. I know the physicians are like, that's called oxytocin. I get it.
That's okay.
I love when that stuff pumps into my system, though. So,
it doesn't matter the science behind it.
Feels real good. It's it's some good drugs.
Grandkids for Joni and I now. It's like such a rush.
I actually, I joke with my wife. I romanticize the idea of growing old with her and becoming grandparents. I know there's going to be ailments, but I look forward to that period because you don't have to do the parenting.
No, you just go out and we go nuts. We go to Idaho and go nuts. Just what do you want?
Yes.
You have up to $1 to spend at the thrift store.
It's just fun.
Yeah, whatever. You know what? I'm going to go to Five Guys and we're going to get 2 bags of fries. there's like
you can tell Mom about it later.
What do you want? Oh, you want a burrito? You're going to get sick? I don't care. Let's get you a burrito.
Won't be in my house. Yeah, exactly. Right. I look forward to that. Yes.
There's some of that. There's some of that going down. Don't tell my kids. I'll get in big trouble. Well, hey, listen. Well done.
I got a candy bar.
You've won not a candy, a quinoa crunch milk chocolate from Dick Taylor.
Sir, thank you. Is this local quinoa?
This is a locally sourced quinoa. Sure. It's organic. It's gluten free. Does quinoa have gluten?
I don't know.
Maybe Nick will find that out. Maybe that's not necessary.
This place is awesome, though. Again, I'm going to talk. You mentioned earlier about Health Desert and stuff.
Sure.
For people who are new to Eureka and new to Humboldt,
nothing like that place.
No, but in general, this place offers so much. So we have an anesthesiologist today. She just signed. She's from New York, studied in Columbia, right? This is like top-notch stuff.
Sweet.
And she's been here as a locum, which is like a traveling doctor. And she goes, I'm signing with you guys. When I go, why? She goes, because I'm just discovering every day how much more there is to do here.
There's cool stuff.
Yeah.
Yeah.
We got to get the word out.
Yeah. Larrapin, Moonstone, Trinidad.
But I mean, like even like
Taylor.
Six Rivers going rafting. You can do outlaw kart racing. You got the Redwood Acres where you're seeing stock cars. Like it's
drag racing in Samoa.
Right. You can go off-roading, surfing, watch the drag race. You can go to the Bay Club right there. Like there's so much.
There's no trails to hike on. They're just gone. there's like jillions of miles of trails.
That's amazing.
Mountain biking. want to go back to mountain biking because,
Sure.
Get back on the horse, right?
Yeah.
Yeah. So I'm going to get that e-bike and do that thing.
Yeah, my wife's looking at one of those e-bikes. Yeah.
They're cool, man. The e-bike's the thing, man. It's so much fun. So take us into the future. So you're this collaborative community leader and you want to try to bring community into medicine.
I like that you called me a collaborative community leader. I'm glad that's on record. Thank you for that.
Yeah. Make sure the staff hears that. Hey, staff. So tell me what you see. What do you want to see? Who
Locally or just
who are
in
you?
general?
What do you want? For Providence.
Yeah. So I do have a vision. It's about 3 to 5 years before we get there, but we're going to be a regional destination. So like I told you, we do amazing things, right? We have comprehensive oncology services. We have a lung cancer program. We have cardiovascular. We have neuro. What we're trying to get dialed in on is I want to clearly understand what the communities are that we serve. And it's not just Humboldt County. We actually get people trying to send us care all the way from Oregon. Wow. Last year, I had to say no to, I think it was 76 transfers because I couldn't find a bed in our hospitals because so many people needed our care.
Wow.
And so what I envision us is Humboldt first is how do we build the network where we have the ambulatory access points, we're coordinating our care with the acute side, where you as a patient, you start in your primary care office, they say you need to see a cardiologist. Before you leave, we should start getting you scheduled. Because the moment you leave, the moment I give you time, the moment I say, here's a phone number, that's the guy who falls through the crack. Right. So that's that first step is how do we build that network where the acute setting and the ambulatory setting were working together. The next piece, and this is what's hard, I think, for this community is we need to get comfortable with we don't do everything here. We need to start acting as a network. And that's where, like, so for Providence in Northern California, SoCal, we're even larger. But in NorCal, we have 6 hospitals. And every hospital, we need to kind of identify what is our identity, what's our place. And that's where I envision us as Humboldt. We know what our core services are. We know what is required to take care of our communities. But you're going to get these onesie-twosie opportunities, right? You're going to get that one person who's got some weird situation
It's
where
got to
you're
go to Napa.
Yeah, like it's going to Napa, Santa Rosa, wherever makes sense, depending on those identities, right? But it's going, okay, hey, we see a handful of this stuff, but not enough of it to do it safely and to do it the way that is appropriate.
Right.
So we're going to send you down to a place that we're consolidating that service to make sure that we see enough of it.
So think like a network and a referral agency.
Yes.
Because it's the right thing.
And we have to make sure those transitions are seamless.
What are the other 4 hospitals? So Napa.
We have Queen of the Valley in Napa, Santa Rosa Memorial in Santa Rosa, and then we have Healdsburg and Petaluma.
Oh, cool. Those are all great hospitals, right?
Yeah, they're great. And we all kind of have our own identities, a little bit of redundancy, and I think we're working on that.
Sure. So opportunities are there. So you said 4 to 6 years out?
I think 3 to 5.
3 to 5.
Honestly, I think like right now, the first step is cementing what we do now well and being very clear on what's core to us as a, we call our hospitals ministries. And so being core to what the ministry is. And so that's cardiovascular, right? That's women's health. That's oncology. That's our trauma program. Those are core services to us.
Birth services.
We need to be the best at them.
Yeah.
And right now, I think we're really, really darn good, but we could be a lot better.
Yeah. Wow. Well said. I wonder about, oncology. Dr. Lou, man, it's
amazing what we do there.
Telling me some stuff about his deal. Betty Chin on the other end, on the outside, and I know that you guys, your ER attended how many people? It was like a record day last January.
We did up to 150 people. I think we see about 40,000-ish people every year in our ER alone.
Those are crazy numbers, right? For an ER.
Yeah.
Yeah. No, I went in April and it was like amazing.
Yeah, we've implemented some cool stuff.
Yeah, I got seen by a lot of people. Yeah. So, collaborative community, we're going to have some good things coming. What we do now? And it's interesting because I think the paradigm is this. So I got a call today on an insurance claim. Yeah. Hey, can you take the claim? Can you fix me? And I'm going, no, it's a whole new model. It's all handled out of Phoenix, Dallas, and Atlanta.
Oh, interesting. Yeah.
It's one phone call. You don't tell the agent and then I tell 10 other people and get your story wrong.
Yeah.
Well, you didn't do that in the old day. I go, no, I know it's old fashioned. You and I think the same way, but it changed about 10 years ago.
Yeah.
And I think people are just not, it's the headspace of old school Humboldt, if you will.
Yeah.
With all due respect to you old school Humboldt people.
There's pros and cons, though. I'm not going to lie to you.
Oh, yeah, absolutely. And good, good, solid salt of the earth. But there's a headspace of like, well, this is how we have always done it. And can't we do a double bypass tonight at St. Joe's? It's like, no. No.
Well, and I'll tell you that too. That's a big one, right? The open heart program.
Mhm.
And it's so statistically, they say you should be doing at least 100 of these cases a year. 100.
Wow.
We're doing about 24 a year.
Yeah.
And it's going to get smaller and smaller as time goes on because we're going to get better and better interventional cardiology, right?
That makes sense.
But I will say it is pros and cons. So for example, I'm looking at launching a hospital at home model. I don't know if it's going to be possible, but we're looking at it. They do it in a lot of hospitals on the East Coast.
Mhm.
And it's cool. So imagine you have pneumonia, you have COPD. There's certain diagnoses that other health systems like Johns Hopkins have determined, hey, we can actually give you inpatient level care at your house.
Cool.
Sounds like such a novel idea, but in reality, I believe there was a time when the doctor would go to your house.
Remember that, Ethel?
It's wild, right? It's like we're bringing it
It's
back.
a long time ago.
Yeah. So I think there's pros and cons.
Yeah.
The systemness, though, the newer part, I know it's a little hard because at first when you launch things, it's never seamless. But the day that someone can walk into that primary care office and the day that someone goes, hey, you need to go see a specialist and I'm going to get you scheduled before you walk out this door, that will be the day that people will go, this is nice.
Yeah.
I would also argue as a community, as we continue to try to attract younger families,
Mhm.
they are coming from what we're talking about. They are coming from these metro areas that already do medicine that way, right?
Right.
It's virtual. It's all on a screen. They direct schedule. They don't call anybody.
FaceTime stuff. Yeah.
So when they come to communities like this, they're kind of expecting that. And if they don't see that, and new physicians are the same way, they're kind of going,
Yeah. So we have to be first. We have to adopt and adapt.
I would agree. Yeah.
Yeah. Yeah. And that takes time, but I like that. So the funny thing, I always find it mystical that Humboldt's not 3 times as big as we are.
Right?
I mean,
have the same
people come
thought,
in, they
man.
go, this is amazing. And there's the Germans hiking up in Redwood Forest.
Yeah.
And there's people and oh, that's such a cool, how do you live there? I come to vacation there. I go,
Yeah.
huh. And I
live here.
and I think quietly there are a lot of folks that have sold in the Bay Area and LA and come up here and
I agree.
they're here already. Yeah, always a mystery to me why it couldn't blossom, but there's a lot of reasons why and why not. Housing.
I think it will, though.
Yeah.
I think there's a lot of chatter right now, and I feel like the chamber and others are starting to really work on how we can. It's an awareness, right? There's Murder Mountain on Netflix.
Right.
How do you change the perception so people see what we see as we live here?
Yeah. And how do we get enough housing for the folks that are here?
Yeah, housing. So
that's going to be the beast. Well, hey, thanks, man.
Thank you.
Don't go yet. I have another question for you.
Oh, good.
What are we going to? This is the really hard one.
Do I get another quinoa bar?
Let me see. Oh, wait, I have an Emery board, courtesy of Scott Hammond State Farm.
I love it.
Located in downtown
Always
Eureka.
wanted one of those.
You're playing for an Emery board.
What you got?
My question is, what would you like us to say at your celebration of life?
Oh my gosh, this is dark now. Huh?
No, not really. It's glorious. It's your end of life. People are coming up and talking about you. It's your gravestone. It's the speeches. It's your legacy, Michael. What would you hope for?
I got two thoughts rattling around in my head here. One is I hope I made a difference. That is what gets me up in the morning. I'm not going to lie to you. I don't mean that to be cliche.
Sure.
You can ask my family and anyone. It's really important to me that if you are alive in this world, you are making a difference. I will admit, as I got older, I used to think that difference would be a little bigger.
Sure.
I was a little naive, but I hope that people go, he did something good. He made something better.
Nice.
I had another thought too. Oh, the other thought was Humboldt's the first place I've ever lived in where I understand the concept of community and the discomfort almost that comes with it, to be honest. But
wow.
I hope that there are actually people there And for anyone who's grown up in the Bay Area, you can understand what I'm saying. It's just, I've never really understood the depth of a relationship until I moved here.
Wow.
And I feel like this is one of the first places that I've ever lived that, like, if there was an Armageddon, we would probably be all right.
Yeah.
Like, you know, like
geographically and otherwise.
But I mean, like, people would rally.
I think they'd
help each other. Where I grew up, they'd be like, you better get off my property.
Right. Run for the hills, man.
Yeah. I don't know who you are, buddy. I'm like, I'm your neighbor.
Yeah.
No, you're not.
Not anymore.
Yeah.
So much for being a good neighbor.
I would hope people would show up, and I would hope that they would think that I made a difference.
I love it. Good answers. And I love your answer of here you are under 2 years old in Humboldt, and you already tasted that and quantified and verbalized and expressed that. It's pretty cool.
It's a magical place, man. I've recently, I don't know if this is a positive or people are going to go, that's offensive, but I've recently said that, you know the tentacles on like ivy? You ever see how ivy grows like along a brick wall or a fence?
Sure.
You know, it's slow, right?
It's got back from Europe. There's a lot of ivy.
Okay. And it's got its little tentacle arms, and they kind of hook, moves, and you just let it go until one day
Took over your building.
Taking it all over, right?
Yeah.
That's Humboldt. Humboldt has this weird way when you first move here, you're like, I don't know, where am I? And then time goes by and it starts to get its hooks in you, but it does it real slow, real quiet.
That's cool. I like that. Good metaphor.
Yeah.
Yeah. No, and you hit on something else that's key, and I love this, and we're going to wrap up here. There's a price to pay with that of discomfort and scratchiness, stickiness, and some of y'all are just a pain in the ass out there. I'm sorry, it's just true.
I don't agree. That was Scott who said that.
Yeah, no. I said it for Nick. No, it's true. There's a price to pay for family, and that's understanding that discomfort of it's 80% cool, 20%. I could just live without it, but that's relationship, that's connection, that's
it is
family, that's people, and
assume positive intent, and it's okay.
Yeah, yes, until it's not. Yeah. Let me tell you about some people I really have. George Costanza's dad, Frank Costanza. What was it? Festivus.
Oh man, I just rewatched all of Seinfeld like a month ago, so yes, I know Festivus well now.
Great episode. I'm going to tell you something about you people. For you Seinfeld fans.
Oh,
some people are going, I don't even, what? The Office? I watched maybe The Office.
I'm going to do this at a board meeting. This is a great idea. I'm going to do Festivus at the board holiday.
That'd be great. Feats of strength.
I'm going to tell some
Join
people.
Lou, get up here. We're going to wrestle. Goldberg, get up here.
Join's a very stacked individual. I wouldn't want to wrestle Join.
I'm pretty sure he's yoked. Yeah, I'm pretty sure I wouldn't want to mess with him. Hey, thanks for being here.
Yeah, thank you. This was fun.
Yeah. I hope to talk some more. And hey, if you're out there and you like what we're doing, send us a lot of cash. We're really big on that. No, I'm kidding. If you like us, love us, comment on us. We're on YouTube and all the platforms. And I think we got second place in North Coast Journal best podcast. Yeah,
it was first.
My good buddy. This week in Humboldt? Last week in Humboldt. And I'm on the spot. Humboldt last week. And his Miles. Yeah, I had Miles on the show.
Okay.
Miles is a terrific guy.
I don't think I know Miles.
Congratulations, Miles. You did it again. No, he's great.
Winner.
You winner. Love you, Miles. Mean it. So thanks for joining us. If we could ever, if you have ideas for us, write me. I'm easy to find. Scott Hammond. Just Google me, or in this case, Chat GPT.
Yeah.
You can find out all the stuff about us. And
except for me, because I'm off the radar.
You are an invisible man. Yes,
thank you.
Till now. Thanks for joining us. Appreciate you. And thank you, Michael.
Thank you. I appreciate the time.